Hi again, everybody, and welcome back to the next episode of the Dental Implant Podcast. So I did promise I would try to do more of these, and here we are, keeping to my promise. And I am very pleased to have my friend Bill Schaefer back with us. So you guys may remember Bill from a previous episode where we discussed Morse taper connections, deep, steep internal connections. He's very kindly agreed to come back. It is now just past 8 o'clock in the evening. So, Bill, thanks for taking time out your evening to do this with us. And for those of you who are listening for the first time, Bill is an oral surgeon. He is dual qualified medicine and dentistry. Lovely guy, very honest with what he does. You won't get any bullshit with Bill. He's not the type of person to stand there and say, "Oh, I never have." He's very open, and this is one of the reasons why I wanted to get Bill on, because Bill, you and I have both noticed a trend recently, and that is increase in failures of implants, particularly in early stages. And at Evo, I'm seeing patients with softer and softer bones. So normally I have quite a regimented protocol for when I'm doing these things. I've got a topic that I want to discuss, but this is kind of like going to be an open discussion, brainstorming session. So if you could just go over a little bit, if you wouldn't mind, just a brief intro for anybody who's not heard about yourself, which I think will be very few people, and then kind of like just let us know what issues you're starting to see, and then we'll bounce some ideas around.
Okay. I'm Bill. I've been placing implants since 1996. I've been placing them full-time since about 2002. So about 20 years full-time. I do nothing but implant surgery these days. Pretty much don't do any restorative stuff. We've got guys for that. I work in a lovely centre in Sussex with some great guys and an on-site lab. In terms of failures, we have quite a big operation. So we've got a stack of surgeons, a stack of restorative guys. So it's important for us to keep an eye on their work and make sure everyone's hitting the right targets. So we look at the numbers of implants that we place, and we look at the number of failures. It's only when you're placing a lot of implants that you will see fairly subtle changes. So the majority of people who place implants in the UK place less than 50 implants a year. Most of those place less than 30 implants a year. And if you're placing 30 implants a year, you're really not going to see trends very easily or very quickly. You just aren't. And we all of us have a tendency to overestimate the number of implants we place and underestimate the number of failures. It's just human nature. We just do. And so it's only if you are placing a lot of implants and actually looking at the stats that you can see trends. So, for example, let's say you had a 1.5% failure rate 3 years ago, and all of a sudden it's gone up to 3%. You've doubled your failure rate, but you've still got 97% success. Maybe you got 4% failure rate or 5% failure rate. You've got to be placing a lot of implants to be able to see that. The things that I am seeing with implants over the last 2 years, really kind of since COVID started, is I'm seeing worse healing of everything. Sockets, just bizarrely healing badly. Ones where you've done the extraction completely unremarkably. It's been as atraumatic as an extraction can be. The patient's healthy, and yet they come back with pus, or they come back with just the soft tissue not looking healthy. And implants, weird failures where the apex of the implant is integrated. It's solid, you can torque it, but you've blown out the top half of the bone. We're seeing weird things. And because we're placing a lot of implants, last year we placed just under 2,000. We see stuff happening. And all of us, every single one of us has seen an increase in our early failure rates. When we audit our implants, we look at pretty much two classifications of implant failure. An implant failure is when the implant is out of the mouth. And we look at early failures, which are within 12 months of placing the implant, and late failures, which are more than 12 months. Because we think that even if it's been restored, but it's still only less than a year from it being placed, that's probably something related to the surgery. And we're seeing an increase, everyone across the board. Those people who always had lower failure rates are seeing 2 or 3 times those low failure rates. People that had slightly higher failure rates are seeing 2 or 3 times those slightly higher failure rates. And again, there are lots of people out there who don't look at their numbers, who really don't know how many implants they place, and they won't spot these. But I'm seeing worse healing in sockets, worse healing in implants, just worse healing.
I mean, that's pretty much exactly the same trend that we're seeing as well. And in addition to that as well is, the average demographic of our patient coming into EVO needing full mouth rehab is getting younger.
Yeah.
So before lockdown, I think, did Rudy show you this data as well? Before lockdown, I think the average age was about 63, 64. Now the average age of our patients is about 57. And we're getting a lot of patients coming in, whether younger and younger, even in their mid to early 40s, where they're just periodontally completely blown out. And the other trend that I'm noticing as well, Bill, is not only are we seeing slower healing, which is exactly what you're seeing as well, we are seeing an increase in early failures. Now, we did an audit. I'll come back to that in a moment because we found out a few things which I will share. But the other thing that we're noticing as well is patients are coming in with really crappy quality bone. Even if they've got the bone volume, the bone density seems to be coming down. Now, you and I have bounced some ideas around, and you know what my take on it is I think that it's not just one thing that's causing this increase in failure rate. I think it is some sort of systemic combination type in syndrome. And what I mean by that is the government basically has been saying for 2 years, don't go outside, sit inside. So the vitamin D levels have automatically dropped. People are stressing about what's going on, which has increased the cortisol levels. People, the gyms have been closed for 12 months and only started to reopen more recently. We're not as systemically healthy as what we were. And I think the cholesterol levels have gone up. People, they're not eating as well. They're getting less exercise. I think all of these things are combining together, and that's what's causing a knock-on effect that we're seeing.
Yes, I completely agree. I would love to have a single magic pill that I can use to make my patients have great bone and their implants to work. I am pushing vitamin D like I never ever used to. All of a sudden, you know when you're starting out with implants and you have a patient for an integration check and you're a little bit nervous. And you kind of talk it, but hold your breath a little bit until the talk wrench breaks, and then you're happy. And I haven't been nervous about integration checks for 2 decades, and yet all of a sudden now, I'm having weeks where I'll have 2 or 3 implants fail, and then I might not have anything for a month, but it's just bizarre runs where all of a sudden you're going, oh, another one.
Yeah.
Like I say, I'm pushing vitamin D much more than I ever did before. I am just going back to my technique and everything. I'm running drills slower. I'm, just anything that I can do to try and reduce the failures by a bit. What is it the Olympic cyclist said? An accumulation of minor improvements or whatever it is. Just trying everything that I can to have. I leave sockets longer now. Yeah. I used to go in all the while at 2 months. Now I'm leaving more and more than 3 months. Yeah. And if they come back and it's still grotty, I'll say, take lots of vitamin D and I'll see you in another 2 months. Mm-hmm. I've got a dentist who refers, a big referring dentist, and he's got a lower 6. and he came in, and I know I could have put the implant in, but it would have been a bit of a struggle, and it just was a bit under par. And I just said, come back in 3 months.
Yeah, so it's, I mean, I'm really emphasizing the vitamin D with patients as well. And it got to the point where we were doing blood tests for everybody, and then it got to the point where we stopped because it was just like, okay, well, you know what, everybody's deficient in vitamin D. That, you know what, instead of doing a blood test to figure it out, we just recommend vitamin D for everybody. And it kind of like, it just became a recommendation that we do. But now I'm really starting to emphasize the importance of this to my patients. I also emphasize the importance of good diet and staying active to my patients as well. And I think it's something that's, you know, these systemic issues, the systemic health of patient and diet, I think is grossly underlooked. You know, we just think, you know, stick an implant in, it'll be absolutely fine. But when we're seeing this increase in failures, we definitely need to pay more attention. So one of the things that I've done as well is I've revisited my osteotomy technique as well. So particularly if I'm in very dense bone, I will time myself 60 seconds between burrs. I've changed over I'm making sure that the burrs are getting changed over frequently as well. But we are still seeing these earlier failures, and I can't put my finger exactly on why.
I got paranoid about the burrs, so we did a big audit about how often the burrs were changed, and they're fine. You know, there's nothing different about them, but still, that's another thing. We change them more frequently now.
Exactly correct. And like you said, it's these small incremental changes which hopefully will start to tip the balance back in our favor. So the audit that we did on our failures threw up something quite interesting. Is a lot of the failures were coming, particularly in them. Now, bearing in mind, we are talking about predominantly full arches. So the failures were predominantly coming in the mandible when we were chasing very high torque, and particularly in the premolar positions when the angles were really quite steep. So when you came out to see me, obviously I was quite happy chasing 100 Newton centimeters, and I've just changed that now. You know, I'm aiming for 50. You know, instead of putting a 24-degree coaxis in, I've now shallowed out my angles to 12 degrees. And the other habit that I've gotten into as well is when I am drilling, is I like to now look at the bone that comes out to make sure it's not like that whitey brown color, that it's nice and pink. And I think that's important. You know, it's and that's a very simple test. Is if you're drilling with a 2 millimeter or anything above a pilot, when the bone's coming out, just take a look at the color. You know, if it's that creamy, that browny color, you either need to change your osteotomy technique or possibly look at changing your drills, because it should come out nice and pink.
Yeah, nothing to add to that. But, you know, sometimes sucky bone is sucky bone, you know, and particularly when you're doing full arches. You know, you drill a hole and it's all yellow, and you drill a hole somewhere else and it's still yellow. And sometimes you just have to take what you're given and work with it. I'm not so, you know, that's just the joys of doing implants. I'm just talking about where it feels like everything has gone right. There's been no surprises. It's been an absolutely uneventful, non-grafting implant placement, and yet it just blows out. You know, and just weird things like,
I remember you put up one of those things a few weeks ago.
I've got loads, and I've put up a lot because I don't mean this to sound arrogant, but in a way I don't have anything to prove, so I don't need to only put up my good cases, and because therefore I can put up my failures and not have to worry about my reputation or whether people will send me cases. I almost feel obliged and a duty to do so that the people that are uncomfortable about posting their failures can at least see that they're not the only ones having them. And like I say, weird things where I'll do an internal sinus lift, a crestal graft, and the graft part of it, the apical part, which was all synthetic bone or whatever it is that I've used, that integrates nicely, but it's blown out at the crest, which is a native bone. What the hell? And it's all buried. So it's not loading, or it's what the hell? And it's not overheating, because that wouldn't be the crestal part that overheats. It would be the deep part. And, I scratch my head and I go, I just don't know why I'm seeing these weird things that I didn't see before.
Yeah, and I've had exactly that as well. I've had a handful of implants which I put in, and I thought to myself, you know what, patient's a little bit medically compromised. Let me put a cover screw on this. You come back, 12, 16 weeks later, you take a PA, and even when the implant's completely buried, the crestal bone's just been lost. And I'm just like yourself, I'm there scratching my head thinking to myself, well, what went wrong in surgery? And the honest answer is nothing went wrong in surgery. So I can't figure this out either.
I always take surgical photos. So I always have a surgical photo of the implant in the bone from two angles. Yes. So I can see if there was crestal bone. I can see if it was thick, or whether it was one of those slightly thinner ones where you go, oh, I wouldn't be too surprised if I lose a bit of bone. And do you know what? I'm seeing blowouts where there's 3 millimeters either side, 4 millimeters, big chunky bits of bone, and the thing blows. Now, fortunately, it's not the majority of cases, but it's enough when you're doing the numbers that we're doing to make you question yourself.
Yeah. And I think in addition to that as well, Bill, obviously there's a flip side of the coin where, the patients start to get upset, irate, and then there's the whole patient management aspect of it as well. So it's whilst it's a nuisance for us in terms of our confidence, but B, obviously a business model is that there's the patient at the other end, and obviously that's what takes priority. And even though I stress to all my patients that there's never a guarantee, there's always a risk of failure. When they do happen, they are gutted about it. So it's and again, that's human nature. I don't blame them.
It's a lot easier when you've built a reputation to be able to deal with failures, both for the patient and for the referring dentist.
Yeah.
It's much harder when you're starting out, and it's also much harder when you're starting out personally, because you beat yourself up. I beat myself up about stuff all the while now, but less so than I used to. But yeah, it's a pain in the butt when you get failures.
It is. So the flip side of this coin, and I only mention this because this lady stands out in my mind. She came to see me for treatment at Evo. And so we're talking about patients healing slowly or not healing. She delivered posts for a living. And when we took all of her stats, her height, her body weight, her BMI was absolutely perfect. Her blood pressure was 120 over 70. Her resting heart rate was like 65. Everything was pristine. And I have never seen anybody heal so quickly, Bill, in my life. And I had an inkling that was going to happen, because she was like, well, Pav, she goes, my job's walking all day, every day. She goes, I probably walk, 7, 8, 9, 10 miles a day delivering posts. She goes, I'm slim because I'm constantly active.
Yeah.
Which just goes to show that, metabolically she was well. Metabolically she was healthy. Her blood pressure was correct. Her cortisol levels were obviously not elevated. She was out and about during the daytime getting vitamin D, and she healed like lightning. This was back in the day where we used to see patients after 3 weeks. It's been pushed out to 6 now because the lab's so busy, but we used to see the patients after 3 weeks. So when I saw her for surgery, full upper and lower, saw her 3 weeks later, couldn't tell that I'd done surgery at all. Gums looked completely pink and healthy. And that's what really got me thinking more about, the link between systemically what's going on, because it is grossly it's grossly overlooked and ignored, because I think it's complicated, and we as dentists feel like we don't have control over that.
Yeah, and it's difficult to bring up with patients. It's hard enough talking about smoking habits and alcohol habits and vitamin D, let alone going, so tell me about how many 5 a days or whatever, vegetables you have, and tell me about the exercise you have. That's a real challenge. It's easier for organizations like Evo, who just do full arches. So the discussions can be different. It's easier for all of us doing implants when we have failures, but it's a little bit hard to just bring it up at the initial consultation. It's the kind of thing that everybody in the UK knows that they should eat healthy, get sufficient rest, and eat a varied diet, and not smoke. But, we suck at all that. So
we do, absolutely, we do. So, Bill, have you come across any of these supplements which are supposed to aid in healing as well? Because there's a few of them which are kind of like coming to market at the moment. So I'm not just talking about vitamin D. There are supplement packages coming out. I know Prof. Shukran has got one. I know it's available in France, and I'm presuming it will be coming to the UK. And I think there is another one as well, which Rob Teague gets from Canada, and it's just supposed to support your healing. Have you come across any of these? What do you think of them?
So in today's society, there should be little excuse for not having a good, healthy diet. We have access to delivery foods from the supermarket. We have supermarkets stocking fruit and vegetables 24/7, 365 days. We should all have a wonderfully beautiful diet, but most of us don't, and most of us could improve our nutrition a bit or a lot. A lot of people get delivery takeouts because they can and they taste nice. They're not the healthiest things in the world. So nutritional supplements, even if you are stock full of the vitamins, all you're going to do is pee them out. So I don't have a huge issue with being sold or being used. Again, there will be lots of patients for whom they have enough vitamins. The hard thing is trying to work out those, let's call it 5%, 10%, who really could benefit from it. And I'm not sure I have. People in the UK with darker skin, I push vitamin D hard, really hard. But everybody could probably do with a bit of a nutritional boost. I haven't yet worked out those. I think these supplements might be unless you can persuade every patient to have them, or if you might use it as a revenue stream. Stock it and push it and sell it. I'm not against that. I'm not. I don't know how to identify the 5 to 10% of people who would really benefit from it.
Yeah, and even those, if they are taking it, if they haven't got a healthy diet and healthy lifestyle, it's not really going to make that much of a difference.
And how long do you have to take them for? I mean, it takes a hell of a long while to get from a low vitamin D level to a decent vitamin D level. It takes months. So normally we're seeing these patients and sticking the implant in within 4 weeks or so. And so even if they're taking high dose vitamin D, they're probably at best going to get to lower end of normal. And with all the with the zinc and the B complex and all these other vitamins that are going to help with healing, how long does it take to get their levels up when they're low? I don't know, but I suspect it's longer than we think. And there are all kind of, Blue M gel and all kinds of different things. And, when you've had a load of failures, you throw everything at it and see what sticks. And you try your best.
Yeah, I mean, that's what it comes down to, doesn't it? We always have these handful of patients where they get cluster failures.
Try and reassure those people who don't work in a big organization with loads of smart people doing implants, but are the only one in their practice doing them, to let them know that even the big guys are finding the same issues that you are.
I think a lot of people are going to find this conversation interesting because
they see us having cock-ups and failures too.
And I think it's purely because there are so many people out there who, they're saying that they have very few failures, or is that they have 100% success rate. And I've said a number of times before is those who claim they have 100% success rate are either telling porkies, or it's easy to have 100% success rate if you're placing 2-3 implants per year. I think it's important for those listening that they understand that, complications do happen. It's the nature of what we do. And for anybody who's noticed an increase in failures recently, you're not alone. Bill and I are sat here saying to yourself, we agree with you. We're seeing the exact same thing. I don't have any golden nugget advice to give to people other than, make sure your drills are changed regularly and make sure your surgical technique's good.
Everything.
Nice. Yeah. It's just, just double check your technique, but we're still noticing this increase in failures. Is there anything else that you can think of, Bill, that might help or might be causing it?
No, people. So the things that people have put forward, stress, which is very, very amorphous. It's hard to pin down. Yes, you increase your cortisol levels. Yes, that increases your blood sugar. Yes, I have zero doubt that will help. But we've always had stress, and how much has COVID linked into it? People have said, "Oh, does the vaccine cause it? Does the virus cause it?" You know what? I can't really say that I believe that. Certainly, I was seeing problems before the vaccine even came out, so I don't think it's the vaccine. I think, like you said, it's a whole load of different factors coming together to make our life harder, and we should be talking about it and not seeing it and losing sleep over it and worrying that it's just you. And there are too many. I'm trying to think of a polite way of describing too many people on social media who stroke their egos and say how wonderful their success rates are and show their great cases, and half of them don't actually know their figures, so they wouldn't know if they had an increased failure rate or not. But those that do, and those that are placing a lot, like I know the guys at Evo, we placed just under 2,000 implants last year. You place that number and you see trends. Evo places 2,000 at each of their centers, don't you? So
yeah. I think it's more than 2,000, but yeah, it's about that. So, and with 2 new clinics coming up online, it's Southern are happy, I'm presuming so. It goes back to that thing, Bill. I think that a big part of it as well, particularly on social media, is cognitive dissonance. I think people are not ready to recognize that they're having failures or ignoring it because they've got courses to push or something along those lines. But as you've mentioned, it's when you're open and honest with these things, I think it actually builds more trust from the people who are seeking advice and guidance, really. And based upon that advice and guidance, I haven't got a lot to give to the listeners today other than what we've already disclosed. It's one of those things. It's a very, very grey, very boggy area. It's nothing along the lines of, you can measure soft tissue thickness. If it's not thick enough, you graft it. This isn't like that. This is there's dozens, if not hundreds, of different factors coming into play, and all we're seeing is trends.
It's not just implant failures. I'm seeing healing of sockets, healing of extractions, noticeably being slower, and some of the healing being bizarrely bad. So that's not implant technique. These aren't challenging extractions either. These are extractions that have gone well, and the healing just sucks. It would be really interesting to see if hospital surgical practice has noticed an increase in problems. That I don't know.
Yeah, no, I've got a few medical friends who are in hospital. I may have to reach out to them and ask them.
Yeah,
but that's a very interesting one. Bill, thank you very much for coming on again. It's been a pleasure to talk to you as always. I know we've mentioned this before, but you just, because I think last time you were talking about you're in the process of doing up your lab, but you've just redone it now, haven't you? Because I know that Carl and Rudy went down to, they were just blown away. They said it's fantastic.
When we set up our centre in Hove, we never thought we'd run out of space, but we did. So we're expanding massively in the basement. We've got a big dining area that seats about 50 people now, but we've got 60 people working at our Hove Centre. So we kind of need that. The laboratory is increased by about 40%, and it was quite a big laboratory before.
Yeah.
So that's in the middle of that. And then we've got the third stage, which is a whole load of more building work for kind of other stuff, but not patients or laboratory. It's just stuff for the staff and management.
Yeah.
But it's a lovely place to work. It's a fun place to be, and the people we've got there are just great. They're just fun, bright, smart, engaging, passionate people. It's lovely.
I mean, I still remember my visit a few years ago. It was just absolutely spectacular. It's just
changed so much since then. It'll be like Evo, just you go back 5, 6, 7 years later, and it's totally different.
Yeah. So, Bill, anybody who wanted to send any cases to your lab, what's the best way to send any cases to you?
So the laboratory is Ceramic Designs Laboratory, CDL. Just go online and they'll find out. Again, they're smart, clever people. They do a huge amount of implant stuff, but they don't just do implant. About 40% of their work is non-implant stuff. Yeah. They're just the equipment they have compared with when we started kind of 8-9 years ago. We got so many mills, so many printers, so much digital stuff. Yeah. It's fantastic. I love it. And it all keeps you on your toes. Like the stuff you're doing. If implants were the same as when I started 26 years ago, I'd be so bored. But because it's all changing so quickly, because the technology is changing, you've got to learn it all. And it's fun.
Yeah, I still love it as well. I'm constantly learning, constantly progressing, and that's the nature of the animal, I guess. So yeah, brilliant. Bill, thank you very much for your time this evening. Thank you all for listening. And until next time, Titani Nerds, if you've got any more topics that you'd like me to cover, please let me know. But I will be speaking to you all again soon.